Hello. I'd like to welcome everybody on the line today to our Healthcare Value Hub webinar entitled A Spotlight on Community Partnerships, the Dahlia Campus for Health and Well-Being. I'm going to start with just a few. This is Lynn Quincy. I'm the director of the Healthcare Value Hub, and I'll be getting the webinar started. Just a few housekeeping rules until we get before our main speaker. All of our attendees' lines are muted until the Q&A session, and we will then tell you how to unmute. You are very welcome to type questions into the chat in the meantime, and we will pick up your questions at the end. We'll try to get to everyone's questions. Today's webinar is being recorded for those that are not able to join live. So if you do verbally ask, or even in chat, ask a question, just keep in mind that's going to go into the recording and make sure you're comfortable with that. If you are having technical problems, if you're hearing my voice perhaps, but you can't see the slides, please call Annalisa Johnson at 202-776-5177. So today we have a wonderful presentation for you. Our speaker is Dr. Carl Clark. He's the president and CEO of the Mental Health Center of Denver. And I'm going to let him tell you what's so special about that place, except I have one slide of setup. Here at the Healthcare Value Hub, in the late spring and summer, we did an extensive effort to identify and organize the policies that would help achieve the goal of a healthcare system that works seamlessly with public health, social sectors, and community members to really meet the needs of people in the community and to advance health equity. This was a massive undertaking. We were really proud of it. But at the end of the day, nothing is more compelling than a case study of a community that has actually done a lot of the things that appeared in this very large report. With that, I would like to invite Dr. Clark to unmute and tell us about what's so special about the Dahlia Campus for Health and Well-Being. Dr. Clark?
Oh, thanks, Lynn. Yeah, I'm always excited to talk about the Dahlia Campus for Health and Well-Being. It was a wonderful project that had just deep community involvement, and I'm going to tell the story about that. We opened in January of 2016, and what we wanted was we wanted to be able to look at the sort of well-being of the whole community, and we were looking for communities in Denver where we felt like there was great needs, and frankly, neighborhoods where access to services and privilege and those sorts of things just didn't exist. So Northeast Park Hill was one of the neighborhoods we looked at, and there happened to be 4 acres of land there. And we bought the land, and as soon as we bought the land, the community was like, we don't want you here, frankly, because of our name, Mental Health Center of Denver. And the idea was that people were concerned about all the things that they had heard about anything to do with mental health. And frankly, there were comments like, you know, we're poor, we're ethnic minorities, and we do not want you putting crazy people in our neighborhood. So that's kind of where we started. But to give you some background about why we even wanted to do this sort of thing, we know about sort of mental health needs in our country. And one of the things that we know is that 1 in 5 people are dealing with a mental illness or an addiction problem at any given moment. And if you look at that group of people that need help, only 2 out of 5 are actually getting help. 3 out of 5 are not getting the help that they need. That's true in Denver. That's actually true everywhere in our country. So we're looking at how can we do something differently. Now, the types of things that we do is we provide services in kind of 3 major areas. One of them is somatic treatments, and that's where you're actually doing something with the body. The things that you can do with the body that will help the brain be healthy. So those somatic treatments include things like making sure people get adequate sleep and exercise and eat right, but it also includes things like medications and transcranial magnetic stimulation, a variety of things that help the brain thrive. We certainly do psychotherapies. We do all types of psychotherapies. And so things like cognitive behavioral therapy and dialectic behavioral therapy, but we also include things that go right with the brain. So this bigger concept of well-being and the science of well-being, and what are those things and activities that people can experience that help the brain thrive. Our viewpoint is that health is more than the absence of illness. What are those things that can move people along the continuum to really robust health? The social determinants of health, we also do that. So those are the things that impact people's overall health and likely have a bigger impact than any type of clinical services, no matter what kind of clinical services you provide. So that's things like, access to adequate food, safe housing, working, those kinds of things. So we do that type of work also. Now, when I say mental health, it's really interesting. The first thing that people think about is mental illness. And if you think about it, every one of us, all of us on this webinar, we have mental health. Like we're somewhere on the continuum. Most of us are probably doing just fine. There are some people that are thriving. There are some people that are dealing with the ups and downs of everyday life, which can certainly impact our mental health, and sometimes illnesses do occur. So frankly, we're sort of all in this together, and that is our viewpoint, is like, where is anyone along the continuum? And when mental illnesses do occur, most people recover from those. And so our approach was to look at how do we go into a community and tap into the strengths of that community, because we know all communities have strengths. Now, the social determinants are this wide variety of things, and certainly the impact of poverty has a huge impact on people's overall health conditions. So how did we get started? Well, as I mentioned, the neighborhood was not happy that we were there, and we began meeting with everybody that we could meet with. And every time we met with folks, it would be like we'd meet with like official community representatives, and that would include like city council and elected officials. But then we would meet with community organized groups. And then we would always ask, who else should we be meeting with? And there are natural community leaders, people that don't have official titles, that are an important part of any community. And we were told things, if you don't talk to so-and-so, nothing is going to happen here. So that's where we started. And as we were talking to the community, we were really trying to find out, what does this community need to be able to thrive? And the community told us early on that we had a tough job ahead of us, because this community had a lot of broken promises. The 4 acres of land that we bought had been the largest African-American owned strip mall in the United States. It was called Dahlia Square, and it had burned down over 20 years ago. And there were multiple developers who had come in promising to do something, and over the 20 years, nothing ever happened. So here was this 4 acres of land in a neighborhood where many promises had been broken. So as we were having our conversations, it sort of shifted over time when we were talking about what we could do there together with the community. And one of the things that kept coming up is the importance of food. This neighborhood happens to be what's called a food desert. Many folks have probably know that concept. It was lack of access to nutritious food. It was also a food swamp, which is a term to describe a community that has access to really unhealthy food, lots of fast foods and those sorts of things. So 2 miles away, you had to travel to get to the nearest grocery store, and yet it was 2 blocks to the nearest junk food. So the community was saying that having access to food was important to them. So our original concept of taking the 4 acres, using 2 acres, and building a 20,000 square foot clinic started evolving to, well, I guess we need to put in a farm. And that's what we did. So we put in an urban farm. And in this slide, you can see in the background, we have an aquaponics greenhouse. That is to grow fish and vegetables year-round. It's 5,400 square feet. And I can tell you as a psychiatrist, I never thought I would be writing grant applications to the Department of Agriculture, but that's what we did. Now, we partnered with a group called Sprout City, which was a group that had expertise in doing urban farming. They had put urban farms in some of our schools in the Denver area. So they had the model, they had the know-how, they had the farmers, and so we brought them as a partner. The aquaponics greenhouse was also a partner with Colorado Aquaponics, a group that really understood deeply how you get these types of operations off and running. And then if you're looking at the screen, to the left of the greenhouse, we actually have community gardens there that anybody in the community can participate in. So when we were talking about the food, it certainly brought up the issue of culture. And so there are a variety of groups that live in this neighborhood, and they wanted to have a place where they could take this food that's now available and cook it in healthy ways, respecting their cultural heritage. So we have a community kitchen that's available, and frankly, it's used all the time. Our model at the Dahlia Campus is to provide the space to anybody in the community that's offering a service to the community for free. If they're going to charge for their event, then we charge them a facility fee. But pretty much we just keep that open. I will tell you that this kitchen is booked out for months. Even if our team wants to use it, we have to get on the schedule. So we heard that the number one reason that children in the area were not going to school was because of a lack of dental care. So we partnered with Kids in Need of Dentistry, which is a group that provides pediatric dental services, and put in 4 operatories so that kids could get access to the dental care. We also learned that access to quality early childhood education was not happening in this neighborhood. So we partnered with Sewell Early Learning, another group that provides early childhood education, and it's an all-inclusive sort of classroom. The neighborhood was worried that if we offered these services, that they would be filled by sort of suburbanites who worked in Denver traveling to downtown to drop off their kids. So when we opened the program, we actually put hand-built flyers on every house in the neighborhood so that the neighborhood had the access to that, to those early child education services. It does include 4 full-day preschool classrooms. And the campus is really built for all ages. We focus on children and families, there's a senior living apartment across the street, and that group was somewhat isolated in the neighborhood, and we have involved them in all the services that we provide at the campus. So, so what's our focus? You know, we're certainly focused on the community. We're focused on the body of the individual, like with our other types of somatic treatments, and we're certainly focused on the mind. We look across the lifespan. So we're treating infants and toddlers. We have an infant mental health program, and sometimes people are surprised about that. They're saying infant mental health. It's really about helping the parents to be able to help their kids. We do encounter folks that have had pretty difficult childhoods themselves and don't necessarily have all the parenting skills that they wish they had to help their children. So we do the infant mental health, toddlers, preschoolers, school-age kids, teens, parents, caregivers, and we have like Roomba classes and yoga and a variety of things around balancing for the elderly. The farmers market is available pretty much every week, and the way that works is people can sign up for what we call bounty boxes, and they pay a sort of a low fee to be able to get quality food every week. Our business model, frankly, is that in the aquaponics greenhouse, 60% of the food that we grow there, we sell to farm-to-table restaurants, and they pay high dollars for that because they know the rest of the food is going to be available to the community at really low prices. There's a family medicine clinic that's across the street from our campus, and if the physicians there write a prescription for food, then we actually make the food available to people for free. So we've been incredibly busy during this time period, and like the slide says, the clinical services are fairly robust. We think calling the campus the Dahlia Campus for Health and Well-Being has opened the doors wide to the community. And it's opened the doors wide in this way. With our name, Mental Health Center of Denver, people ask themselves the question of, well, do I have a mental illness? So if somebody's depressed, they might say, am I depressed enough to need to go to a place like that? So they can sometimes filter themselves out from access to services. Our focus on well-being, we feel like, opens the door wide. Who doesn't want their well-being to be better? And people look at this as a place where if you want your well-being to be better, that's the place to go. So we do focus on the positive psychology and what things can go right with the brain. And we also then can dive deep into if there are issues of depression or anxiety or other issues that are going on that are affecting their overall health. We put a big emphasis on being able to be inclusive and for people to have access to services. So we have a program for people that are deaf and hard of hearing. We have programs that help people who are dealing with HIV disease. We have programs that look at making sure that the overall health of the person is being addressed by integrating the care. So if we're providing behavioral health services, we're working with their primary care practice to make sure that's all coordinated. We decided not to put a primary care clinic in this facility for two reasons. One, the bulk of the folks that we see there are kids, and most of the kids that are coming to our program are already connected with a pediatrician, and we didn't want to disrupt that relationship. For those kids And families that aren't, there's a family practice right across the street, and so we connected with them to provide those services. So we've been busy since we opened. The campus is really popular. We've served over 4,000 people in the very first year in the community after we opened. We have groups that have really claimed this space as their space. As I was mentioning, there's Roomba classes and yoga, and there's dance classes for the seniors, and there's all kinds of exchanges that occur where people bring in clothes that they no longer want and then exchange them for clothes that somebody else doesn't want. And it's been actually, frankly, more exciting than we even imagined. We did get some accolades. Like I said, this project turned out better than we ever expected. So we won the Project of the Year from the International Association for Public Participation. I can tell you we didn't know that group even existed. They probably wouldn't like to know that, but it was really about how do you deeply engage a community to have the community inform what services or products that they need. And we believe we got this award because it was so focused on human interaction between people, between us and the people that live in the community. And you can see the other awards there, the Fast Company magazine, World Champion Idea finalist, and the National Council for Behavioral Health, which in my world, being in behavioral health, was quite meaningful, and the U.S. Green Building Council. So that's a lot of stuff, and people always ask, well, so how did you actually pay for this? And that was an interesting process too. In the beginning, we're a financially sound organization, and we were able to, frankly, consolidate all our debt and then bring in more funding through issuing bonds, which a lot of nonprofits are not in a position to do that, but there can often be other abilities for them to tap into bond issues either through their local governments or state governments. But we were able to issue our own bonds, which paid for the basics for this building. Our philanthropic community was quite interested in what we were doing and liked the idea that we were doing something in a different way. So they provided a significant amount of support to help get this project off the ground. The overall project was about $18 million, and the philanthropic community provided $8 million of that funding. So that made a big difference. We like this model because, frankly, it just hasn't been tried before. Now, the governance of this is multi-layered. So first of all, as the Mental Health Center of Denver, we have a community board that comes from across the community and across the entire Denver community. So that's what governs our organization. We continue to have the community involved in what happens with this particular campus. So we have multiple relationships with community groups that we are also members of to keep informed about, are we continuing to do the right things, with the question of what do you want us to do more of and what do you want us to do less of. So if you want to know more about this and to kind of get some visuals, you can certainly get this to their website, and these materials will be available to you after we finish today. In Colorado, if you happen to be here, we want to make sure people have access to services. It's our goal that everybody have access to services, whether they see us or somebody else. We know only 2 out of 5 are getting the services. and these are the kind of resources we put out there. We happen to have a walk-in clinic that's available 24/7. So in the Denver area, we like that word to be out that if anyone's having a concern that they can go to our walk-in clinic. And then there are a variety of other resources that we encourage people to read, like Tom Rath's book about the concepts of well-being and Barbara Friedrichsen's book around positivity, and a book that just talks about the basics of eat, moving, and sleeping and how that impacts your overall health. So here's the visual of our campus. So we went from the concept of a 20,000 square foot clinic to a 45,000 square foot building. Instead of using 2 acres, we used all 4 acres, and it's a lively place. The one thing I believe I missed out as I'm looking at this slide is that we have a Skyline Academy. So this is a school. We're an independent school district, and we get referrals from Denver Public Schools to come in and for kids that are not doing well in the sort of public school system. And our goal is to have those kids address whatever emotional needs that there might be and to have them get to a place where they can go back to Denver Public Schools. Denver Public Schools really loves this program because there are a lot of programs where once the kids are in them, they never actually go back to regular public school. So we feel quite happy about that. And I would say that's it.
Well, this is Lynn, and I say, wow. I'm going to advance past your slide just so I can tell people to ask questions. So I'm going to give those instructions. I'll probably then start with a couple questions of my own. So for our audience members, you can type your question into the chat box and I'll read it aloud into the recording. Or if you want to verbally ask your question, you can unmute yourself by pressing *6. I'm going to ask Dr. Clark a couple questions, but I'll provide some space for people to ask their questions verbally. And don't put us on hold because then we'll hear your hold music. I think someone did put us on hold, but there, I think we're better. No? All right, Tad, I don't know if you can track that down. I'll go ahead and try to talk over the hold, Dr. Clark. So this is an amazing
opportunities at the.
I'm sorry, I muted you guys and sent myself to somebody else's phone number. Sorry.
Oh, that's okay. You're back though. That's wonderful.
Yeah.
Well,
so did you ask me a question because
not yet.
Okay, all right.
Not yet. You returned just in time. I was just sort of singing your praises for a few minutes there. This is an amazing story. And I know it must have been so much hard work. And I'm probably going to ask you a few questions that reflect the fact that I'm not an expert in behavioral health, but perhaps our audience is right where I am, and they don't mind. So across the entire mental health system for Denver, did you already have the focus on social determinants of health, or did it really kind of come to fruition with this campus?
No, it didn't start with this campus. We'd been doing this kind of work for a long time. So we've been around for 30 years, and when we were a merger of 4 separate mental health centers into one, which frankly was a Robert Woods Johnson Foundation grant to kind of consolidate these 4 separate centers. And in the very beginning, we had the viewpoint about community involvement. And so we asked the community right at the very beginning, what do you need from us? And the very first thing was, it's really hard to get well if you don't have a place to live. And so 30 years ago, we started a housing corporation to develop affordable housing. because many of the folks that we needed access to housing. So there was that aspect of it. But we also early on heard from the community, it's like it's really hard to make it if you don't have a job. So focusing on housing and jobs and helping people go back to school has been a part of our history the whole time. This project felt different because the community was telling us many things beyond that. You know, the food, no. What had we done that? Not at all. So.
Wow. Well, I have some more questions, but first I'll ask you one from Megan. It sounds like you greatly expanded the scope of your services based on input from the community. Can you talk about what it was like to do that internally? For example, was it difficult to secure buy-in to the idea that you'd be offering new and different services like farm, community gardens, Zumba, etc.?
It was definitely a journey. Um, so so I think a part of it was that we got there because we found community partners that already knew how to do these things that we hadn't done before. So the farm would be a good example. When City Sprouts, you know, the community saying we need food here, and we had the land, and so we started looking for community partners. Is like, well, does anybody do this work? And so then it was like, yes, there's a partner. And so I think a lot of those new services weren't teaching our staff how to do new things, but maybe our learning curve was, how do we bring in a community partner in a real partnership so that folks can get what they need, and yet we're sort of doing this together. And there were questions, there were questions even from the board of, are we drifting from our mission of providing mental health and addiction services? And putting that in the bigger context of how the social determinants have such a big impact, to not pay attention to that would not be helpful. And we already had that history in the housing and the jobs. So that wasn't a big leap for my board, but it definitely was, a question among staff is like, we're going to be selling fish? Like, I didn't, it was eye-opening. I'll just put it that way.
It had to have been. So, and that's a nice segue to one of my other questions, which is, it's almost like you created a community center that emphasizes well-being and sort of snuck in the mental health. I mean, it's, to a neophyte like myself, that's how it comes across. And I didn't know if that was the intention, if it's something that you think is actually a really good way to do it, sort of a community center forward, or can you just speak to how very different this campus is and how we should think about it?
Yeah. So when we were having those early conversations and with the community and the community groups, and there was the viewpoint that people with mental illness were those people, like they were somebody else. And as we talked about the work that we do, it eventually shifted to where people were saying, oh, I see, you help somebody like me, somebody with anxiety or somebody with depression. So I think that was a really strong turning point when the community got that it wasn't this, I don't know, maybe some stereotype they had in their head about what mental health was. It was like, mental health is like for real, live, regular people. So I think that helped. And then I believe our listening to the community about their understanding of what the community really needed to thrive, which was, like the food and the daycare and the early, child learning, all of those sorts of things, and our willingness to go there with them, I think did in fact create a new model. This like, it is this bigger concept of well-being. And I will tell you that the community named the facility too. you know,
Oh, well, that's
so
wonderful.
yeah, so we worked with them in concepts and that sort of stuff, but the community said, this is the Dahlia Campus for health and well-being. And
Mhm.
so, and we are looking at doing this again. Um, this community, it started with them not wanting us there. We have two other Denver communities that have asked us to come and do this with their community.
Wow. Amanda asks, are you aware of any similar models in other states?
I've heard of a similar model. I don't know how they got there, but it's in Florida. And I wish I could even tell you where it is, but I think the similarities are it's kind of a campus model with a kind of a wide array of services. I don't know how they built it. I don't know how they you know brought the elements together, but I've heard of that one. But other than that, I have not heard of any others.
Yeah, it does seem like a rare animal. I want to provide a moment of silence. Is there anybody who would like to chime in verbally by pressing *6 to unmute themselves? Okay. All right. Hearing none, I'll be sure to provide some openings a little later too. So, uh, you do think that this is a bit of a new concept, and is it? I'm just so fascinated by the evolution of this. It's always so interesting when you create something that has never existed before. You have imagining something that does not yet exist is one of the most difficult things. And I'm wondering if the impetus here was to create this new model of addressing behavioral health by almost thinking of the entire community as your clientele and getting the entire community to well-being, or was it that you needed community buy-in and it almost happened accidentally, or maybe it was even a mixture of both?
Well, so I do think it was a mixture of both. Um, so I'll tell you where we started this journey. So we were looking at, so Denver's a very neighborhood sort of oriented city. If you ask people where they live here, they'll tell you what neighborhood they live in. And so neighborhoods are very important. And we were looking at where we needed to address any gaps in needs for children and families. And there's a map in Denver that we like and don't like at the same time. It's a map of where children in neighborhoods are at high risk. We like that there's a map that shows that. We don't like the term high risk kids, right? We like high potential kids. But anyway, we used that map and we looked along there. It wound up being two corridors in the city, one that went from east to west in kind of the northern part and one that went north to south in the western part. So we were looking in those communities for a property, for one, and a place where we felt like providing access to services might have a big impact. Our viewpoint, though, was really about providing, services for children and family around mental health and addictions issues. That was our focus. So when we went into the community, and we've done this with affordable housing, so the idea of involving the community was not a new idea. Involving the community from the ground up with a clinic, though, that was a new idea. I mean, we had not done that before because it hadn't happened before. And so when we went in, we have the viewpoint that communities have natural strengths, and communities that might have poverty have natural strengths, and rather than apply what we think will help them, to ask them what will help them. And so I think we did that in a more robust way than we've ever done before. And that was the surprising part. Like, I really didn't know that the conversation was going to land on food as early and as quickly as it did. And so if you've got a commitment to that community, how can you not do something about food? So I think that was really what guided us. And so that, for us, I think was the joyful learning experience. Now, here's the other part that I just love, too, is so what makes us uniquely human being, right, is our imagination. In fact, some people say that's why Homo sapiens made it and the other human species didn't. But our ability to imagine, it really distinguishes us from all the other animals. So we have the ability to think about things that have never existed. So in nature, buildings don't really exist, right? I mean, ants make termite mounds, but, the things that we've conceptualized, are there because of human thought and human imagination. And when collectively a group imagines something and then works together to make it happen, I think that makes us uniquely human. And I think that's why we got so much buy-in from the community. A story I'll share is that the contractors who were building the building made a couple of observations. It's the first site they had been at, there was nothing tagged, and it was the first site they had been at where nothing was stolen. And it's because once we started to build it, first of all, we couldn't build it fast enough once the community had buy-in, and they watched that site the whole time. The seniors that live across the street in the senior housing, we'd get phone calls from them saying things like, there's a guy there in a green jacket. Is he supposed to be there? Because they wanted to make sure that that place that they were a part of was going to get built and sort of protected.
Well, that's amazing. So speaking of buy-in, in the queue we have here, Brianna asks, what can current health systems in communities do to increase community buy-in to services provided or to learn what services they should offer? Do you have advice for an existing health system?
Yeah, I think it's doing the work around actually meeting with communities and going out. So as a result of this experience, we created a position within the organization, which is our vice president for strategic community partnerships. And their role is really to make sure that we're engaging in any community that we're providing services to, and to get that kind of input that helps shape what we do. So I think any health group can do that. This happens if you put the resources behind it. It will happen much more slowly if it's other duties as assigned. So I mean, it's sort of a real commitment, and this took a lot of time. I mean, and these were not like regular hour type events, right? Mm-hmm. It's like the community's going to be at 7:30 tonight, and it's like, okay, well, I guess I've got a 7:30 meeting to go to, because you have to be open to fitting into when the community is available.
And if someone were to, I'm sure many people listening today are wondering, how do we recreate this where we live? If you were to begin to engage the community in this way, would you need to have a certain level of resources at your disposal in order to not disappoint, in order to manage expectations? I mean, is this best accomplished by a fairly well-resourced organization?
Well, resources clearly are important, and I'm trying to think about how this happened with us. Financially solid organization, I think you've got to have at least part of that. I think it's also, though, being able to tell the story to garner the resources to support it. You know, when we told the story to the philanthropic community that we have a community that does not have access to adequate food and that we wanted to put in an urban farm, they were supportive of that. So I think it's really telling the why you want the support and to see if, in fact, you can then come up with a business model that supports that. That was the great thing about working with Sprout City, is that they had a plan of how do you take a farm from, you know, nothing in the ground to plowing the ground to planting it to harvesting it, and how long does it take for that to be self-sustaining? And it's a 3-year model. And so we got foundation support to support that in the beginning, and now it's self-sustaining. And it was similar with the aquaponics greenhouse. So so I do think that there. So when you're working with a community and they're asking things, you know, sometimes the answer is, that's a great idea. Let's keep seeing if we can figure out how to actually do it, instead of promising it when you haven't figured out whether you can do it or not.
Okay, that's great advice. And I lost the view of the slides. I'm just saying it out loud in case others did, and I'm sure Tad will bring them back. So I'm going to have one more moment of silence in case anyone wants to hit *6 and ask a question verbally. Okay. All right. Not hearing any. I'm going to ask my last question, and then I'll tell people about our upcoming webinars. Oh, thanks, Tad, for bringing those back. So what's next for the Dahlia Campus? Do you still have things in the queue that you're trying to do? What can we expect next year if we bring you back?
Well, you know, so since the governance of the Dahlia Campus, you know, we're still connected with all the community groups. That will always be evolving, you know. So, you know, we have yoga and Zumba now, but who knows what we'll have a year from now. So that sort of community engagement, that part will stay the same. We are looking at some other communities, and every community is different. I think the approach that we do with the other communities will be a similar approach. You know, who do we talk to? Who else do we need to talk to? Who else, you know, is somebody that we need to make sure we include in this process. So I think the process will be the same, but the needs won't be the same because, you know, communities are unique in their own way. So the next project we do, and so I'll give you kind of an example. You know, we are working with a community right now that has, it's an even more diverse neighborhood than this neighborhood. This neighborhood was predominantly African American and Latino, and this other neighborhood, there are 9 languages spoken in this particular neighborhood. And the issue there is they don't have a library. And so it's working with the Denver Public Library about, like, how this group, like, wants a library, right? So how do you bring a library into that? And are there mental health needs? There are. But so the next version might be we're providing mental health services in a library. I mean, it might be that. I'm not really sure. But that's where, you know, the community being involved in saying what they need has a big influence on what you actually do.
You know, I promised that was my last question, but you made me think of one more that I have been dying to ask. You mentioned that you met with the official sort of community leaders, but then you also asked for and were connected to kind of unofficial power behind the throne community members. I'm imagining these are people who have just a lot of moral authority, a lot of suasion within the community. And
Yes.
I was wondering two things, like what kinds of people are they? And how do you know when you've found them all and maybe there's not some one, hidden deeply that is hard to locate?
Yeah. So I think it's a couple of things. One is, always ask, we've met with you. Is there anybody else we should be meeting with? Who else in the community would want to, be a part of this? You never stop asking that question. And the way I think we got there is that certainly there were the officials, right? I mean, so no city council person wants you to do something in their district without them knowing about it. So there's that kind of official thing. And then there are the groups that are already organized within a community. So that might be like a neighborhood association, or it might be, in this particular area, there was a group that was trying to help people do gardens in their yards. So we connected with that group. So anybody doing anything there, you go talk to the leadership there and then ask them. It's like, you're doing the community gardens. Who else should we be talking to? And I think eventually it does sort of result in you do have those folks that have been in that community for a long time, that if in fact, if you don't talk to them, nothing is really going to happen. So it's just being, I think, passionately curious. Maybe that's the way to put it. Like, who else should we talk to?
Yeah. Oh, I love it. I love it. All right. Well, with that, this has been, it's an amazing journey you've been on. I think everyone today is really grateful that you have shared your story. The resources that Dr. Clark mentioned, some are at the Dahlia Campus website, and then we will also be sharing a link on the Hub website to some Hub-related resources, and the ones that have been mentioned, that will go to everybody who registered for the webinar today. And speaking of webinars, first of all, Dr. Clark, thank you so much. We also want to thank the Robert Wood Johnson Foundation, which sponsors this series of webinars. And not surprisingly, we have another one coming up, a very different topic. It will be October 25th, Public and Private Strategies to Address Healthcare Provider Consolidation. What a change of pace. But it's important, and you can register right now at healthcarevaluehub.org/events. So with that, I'm going to give everybody back a few minutes in their day. Dr. Clark, thank you again. This has been wonderful.
Well, thanks for inviting us. This project turned out better than we ever dreamed, and I love talking about it.
Well, thank you again. Everyone, have a great afternoon. Thanks for joining us today. Bye-bye.
Bye.